the U.S. Food and Drug Administration as a senior policy advisor of scientific investigations in the FDA's Center for Drugs. In my 34 years at the FDA, I've been quite involved with setting policy for the prevention, detection. Health and wellness is a topic near and dear to us. We are all aging, some of us gracefully, others seeking the grace to manage a myriad of issues. There is a quote stating, "A healthy outside starts from the inside." Today we will hear from two eminent physicians who will share their experiences, expertise, and insights on identifying and managing some of the mental health issues that are prevalent in the community that we live in, and the issues that are taking a toll on us as individuals, as families, and as communities. We have two speakers whom I will introduce shortly. They will each speak for about 20 minutes. Then, if time permits, we will address the audience questions, if there are any. Irrespective of the number of questions, we will have to have a hard stop at about 4:45 p.m., at which time we assemble for the group photograph. You may submit your questions in writing, and I will try to consolidate them and try to get through as many questions as possible in the allocated time. Our first speaker is Dr.A.E. Daniel, MD, who is from Columbia, Missouri. He's married to Molly and has 2 daughters and 5 grandchildren. He was born in Karunagapalli, Kozhikode Marthoma Church, was his church, and his parents were Dr. A.D. Isho, who was a homeo doctor, and his mother was a school teacher, Mrs. Isho. He's proud and wanted me to emphasize that he graduated from a government high school, not a private high school. He earned his MD from the University of Kerala and finished his postgraduate training at the prestigious NIMS Institute, which is the National Institutes of Mental Health and Neurosciences. He completed his residency in psychiatry at the University of Missouri and a fellowship in child psychiatry at the University of Missouri. He's been in practice for 40 plus years and is experienced as an expert witness. For example, in the last 4 years, he has been an expert witness for about 80 plus cases. His general specialties are psychiatry and correctional healthcare. He has authored and co-authored several peer-reviewed articles in correctional mental health, and particularly on risk identification, prevention, and risk management strategies, including those strategies relating to suicide in jails and prisons. He's also one of the co-authors who updated the World Health Organization's resource guide of suicide in jails and prisons. He's conducted several seminars and in-service trainings on suicide prevention and interventional strategies to mental health staff working in prisons and jails. Formerly, he has been the associate editor of the Journal of American Academy of Psychiatry and Law, and recently has a book on suicide in jails and prisons. I've cut short his bio so much, just in the interest of time. It's a very impressive record, and I look forward, along with you all, for a presentation at this moment. Thank you, Dr. Daniel.
Abhivanya Isaac Felix Vinos Tirumeni, Vishishta Vaidiganmare, സുഹൃത്തുക്കളെ, ഭാരവാഹികളെ, ഈ സമയത്ത് ചില കാര്യങ്ങൾ എൻ്റെ അനുഭവത്തിൽ നിന്നും ഷെയർ ചെയ്യാൻ ഉദ്ദേശിക്കുന്നു. So I'm going to switch it to English, which is more comfortable for me. US Surgeon General Dr. Vivek Murthy issued a 95-page advisory report to the President of the United States saying that social disconnection or loneliness is a major issue in this country. 49 to 50% of the people suffer from extreme social disconnection. And he identified social disconnection as the leading cause or one of the causes for number of illnesses such as anxiety, depression, and also leads to cardiovascular disease, stroke, dementia, and number of other physical conditions. Back in 1990, only 3% of the US population did not have a close friend. In 2021, it is 12%. See the progression of loneliness. That's just one identifying marker. Some people blame social media and technology. Some people blame COVID-19. Whatever the case may be, the upshot is we are a lonely country. Back in Kerala, you may know that many of your parents or our parents live in isolation and loneliness. This is particularly an important issue for those who are health challenged because they may not be able to get to the medical attention or emergency room in time. Of course, we have technology now we can use it positively, which I'll refer to in a few minutes. I'm going to talk about some mental states or conditions. I'm not going to the serious mental health issues which are quite common. For example, 1% of the entire world population suffer from what is known as schizophrenia. That's a serious mental illness. I'm not going to talk about it because that will take a long time. But I'm going to talk about loneliness, isolation, hopelessness, anxiety, suicidal tendencies, and suicide. Loneliness, of course, is ekantata. Hopelessness is pratyasha illayma or pratyasha kurav. Anxiety, utkantha. Depression, vishadam, dukkham is a normal state. Suicidal tendency is atmahatya pravanata and atmahatya. There are certain common words which will describe. There are a lot of synonyms for loneliness. For example, being alone, lone, desolate, forlorn, isolation, seclusion, segregation, incarceration, and solitude. Among these words, there are two words have same Malayalam word. That is loneliness and ekantata. But when you consider loneliness, it has a negative connotation, whereas when you consider solitude, it's mostly positive. You may know that in solitude, great pieces of art, music, poetry, scientific discoveries occur. But in ekantata, or in loneliness, it can lead to a number of psychiatric or psychological problems. Jesus is the greatest example of solitude. In the Bible, we are reading there are at least 6 occasions Jesus has gone into solitude. For example, Gospel according to Mark, chapter 1, verse 35 says, "Early in the morning, still dark, he went out of the house. In fact, he departed from the house to a solitary place for prayer." So in that context, there are of course other references, but in that context, we are looking at endurance and strength. The same approach you and I can take when we are faced with difficult situations. You may want to retreat in solitude. So those who can handle solitude without the devices, without negative thoughts, are healthier people. Keep that in mind. For the sake of time, I have constructed 2 stories. And if you listen carefully, these 2 stories, some of the answers that we face in everyday life will come to the front. First story. For the sake of time, I'm going to read it. Otherwise, I can go on saying the story. By the way, I like stories. എൻ്റെ വല്യപ്പച്ചൻ അദ്ദേഹത്തിന് 70 വയസ്സോട് അടുക്കുമ്പോൾ എനിക്ക് 4 or 5 വയസ്സുണ്ടായിരുന്നു. പുള്ളിക്കാരൻ എന്നെയും കൊണ്ട് കായലോരത്തോട്ട് പോകുമായിരുന്നു. പോകുന്ന അവസരത്തിൽ വേദപുസ്തകത്തിലെ കഥകൾ ഓരോന്നായി അദ്ദേഹത്തിന് നല്ലോണം അറിയാമായിരുന്നു, പറഞ്ഞു തരുമായിരുന്നു. അതിലുപരിയായി 23-ാം സങ്കീർത്തനവും 121-ാം സങ്കീർത്തനവും എന്നെയും കൊണ്ട് കാണാപ്പാഠം പഠിപ്പിച്ചു. വളരെ നാളുകളായിട്ട് എനിക്ക് മലയാളത്തിൽ തന്നെ അറിയാമായിരുന്നു. പക്ഷേ ഇപ്പോൾ Psalm 23 and 121, I have it on my laptop for easy reference. So that's the importance of connection with previous generation, your grandparents. Story number 1. Sarah. Isolation was a feeling that Sarah has become ever so familiar within her life. An only child, born to 2 successful business owners who were often too busy with work to give her the attention and love she so desired. Growing up, Sarah most of the time was alone. She felt an outcast among her peers who had siblings close to her age. Even when she made friends, her parents pushed them away, too busy to allow them in their house. Her parents provided her with what they thought was proper upbringing and material possessions. However, they were unable to teach her any empathy and understanding of others' suffering. They were mostly concerned about their ego and the accolades. Sarah remembered her mornings at home. Her father would be anxiously checking on his computer the stock portfolio, and her mother frantically organizing her day planner. They had only little time for her. Sarah would try to speak to her parents to break through their curtain that they created, but to no avail. As Sarah entered her teenage, she would sink into deeper isolation. She locked herself up in her room. Disconnected from the outside world, she has become so addicted to her device. Socially isolated, thought about suicide. Her parents did not know how to handle her sudden change in her behavior. They were so used to being their perfect daughter, never causing any disruption. As she continued to suppress her inner thoughts, she had slowly shut herself from the outside world. This is a story I composed based upon my 52 years of psychiatric practice. It is not imaginary. At many different levels, this happens in everyday life. This is the most vulnerable period, but long time in coming. Depression, persistent anxiety, suicidal thoughts, drug abuse, juvenile acting out, body image problems, eating disorder are common during this period. Anger outbursts, sulkiness, and drop in grades may occur during this time. There's a new study out recently from the nation's Children's Hospital and Ohio Poison Center that shows suicide attempts among teenagers have increased substantially, and they use common methods found in the household. Be aware of that. More found in the rural areas. They mostly occur during the school year. Second story. Story of Alice. Alice was an elderly woman from an agricultural family in the Midwest. She was the grandmother of 2 and mother of 5. Alice had a hard life. Her husband had passed away a few years ago. Alice was left alone in her small house, surrounded by cornfields and the occasional cow. She felt lonely and isolated, as if no one was really around when she needed them. Alice began getting depressed, and she contemplated suicide, and her doctor prescribed her antidepressants. This helped her a little bit, but she continued to feel low. She stopped going to her community groups and her church. One day she received an invitation to attend a meeting for seniors who had suicidal thoughts. She was hesitant to go, but decided to go anyway. Alice was surprised to see how many people were there and how similar were their stories. It made her feel less alone and made her realize that she was not the only one who felt this way. So these are 2 stories. Let me proceed to, for the sake of time, my favorite topic, talking about suicide. Feelings of isolation are a significant part of human experience, though they manifest differently from individual to individual. Hopelessness is a crippling human emotion, and that can have lasting impact on the physical and the psychological side of all of us. Despair caused by hopelessness may lead to depression, exhaustion, and anxiety. Such a feeling may result from various childhood experiences, such as child physical abuse, sexual abuse, parental loss, lack of parental affection, and chronic stress. Okay, what is suicide? Suicide is an intentional act of self-destruction. It begins with ideas, leading to development of a plan to harm themselves, and finding a means to accomplish that act, and engaging in that act, finally ending in disaster. So that's the progression, it's a continuum. There's a binary distribution of suicide, meaning that 2 stages of life suicide are more common, 15 to 34 and 55 and above. This is a binary distribution there. It's an interesting thing to note that Catholics have the lowest rate of suicide in the world. You may ponder about it. There is about 12 people out of 100,000 population die by suicide every year across the world. That statistics have not changed during the last 30, 40, 50 years. But there is a certain group of population which has high propensity for suicide, namely people who have served in the army, soldiers and veterans, and also people behind bars, which I have studied quite a lot. But that is the high vulnerable group. Okay. Every morning, my wife Molly will tell me what is happening in Kerala with regard to suicide. Whenever she gets a message on YouTube, and it's so common among young women in our part of the world. You may know the causes of it: dowry problems, in-law problems, academic pressure, debt. All of these contribute. This is a unique phenomenon for our part of the world. I have not come across this. I get information from across the world every day on my Google Scholar, but this is a phenomenon. And of course, if I have time, I can address the causation of it, but be aware of that. Okay. Suicidal thoughts are transient. It occurs for a short period of time. If you can catch those thoughts, you can change them. There are a lot of theories, I'm not going to it. There is philosophical theories, theological theories, or socio-political geopolitical theories, but I'm not going to it. Just a couple of sentences about psychological basis of suicide. When someone reaches a point in their life where there is narrowing of interest in their life, nothing matters to them. I don't want to live. I cannot go on. I am a burden to others. And they cannot find the coping resources. This creates a level of anxiety, and that leads to agitation, restlessness. And if you are an impulsive person, that's the most vulnerable time a suicide occurs. So, what the doctors do, what the psychologists do, is based upon a simple principle that you and I can use in our everyday life. Change your thoughts, or thoughts causes behavior. Simple equation. If you think about that particular thing in everyday life, thoughts changes behavior. Negative thoughts leads to negative outcome. Positive thoughts create positive outcome. There's also another principle. If you become more active, your mood changes. So remember not being a couch potato. How do you manage all these things? Just identifying 4 steps. First is identify the problems. Reflect, analyze, identify the source of hopelessness, anxiety. Reflect upon our environment, what makes me anxious, what makes us, concerned about things. Analyze the cause. If you have a career problem, you identify the problem. If the problems are persistent, change your job. This is US. Develop a plan. Seek support from family, friends, pastor, and church. Start a conversation with people who are naturally positive. Toxic people create toxic environment and outcome. Talk to positive people. Engage in relaxation. You can journal. Another important point I want to make it, all of us, or most of us, I believe, is in the 60s, 70s, and 80s. I would really suggest move, M-O-V-E, get up and move. Meaning not from here to next location, but physically being active. Exercise creates the best antidepressant property. So that's important. Prayer, meditation, mindfulness breathing. Then all of these fail, then you can seek professional help, and antidepressants are there. I'm not going to go into it. But Sirmeni wanted me to talk about family relations. And as you heard the story, these 2 stories, those young Sarah and older person, elderly person, Alice, were helped by family. They established technological devices to make connection with them, and they had video chats, audio calls, etc., etc. I have a friend, actually she's my classmate, she's approaching 79, and I was talking to her the other day, and she has faced a lot of difficulties in her lifetime. Her husband passed away. 2 weeks ago, she and I was talking about, personal stuff. We have been friends for years, and she is coming from a very large family, and she said, "Look here, Daniel, alpam vishadam seti, at this age." So we talked. So what do you do for vishadam? She said, "I take some antidepressant, my psychiatrist prescribed medication." "What else do you do?" And she said one important point, which I remember very clearly. By the way, you probably know this person, I'm not telling the name. She is a well-known gynecologist in Trivandrum. She comes from a very large family, and all of her siblings are in this country. But what she does is that 9 p.m. every night, she on to her computer and engage in the family prayer. Her siblings are in New Jersey, whatever states they are in, but this is consistently done, and that's her family connection. That improves her mental state. Finally, 1 minute. I want to talk about this morning. Barnabas Tirumeni talked about faith. Of course, I'm not going to outwit him. I just want to say a few points about faith. How can we use faith in our daily lives? What is it? What does it mean? Faith is a powerful weapon to counteract feelings of hopelessness and loneliness. Faith can provide a sense of comfort, identity, and most importantly, it counters the feelings of isolation and despair. It gives the feeling that life can be improved. It can function as a coping mechanism in times of stress. Faith is important to nurture mental health. Faith provides a sense of vertical connection to our Lord and a horizontal connection with the people that we move with in church, society. So this vertical and horizontal intersection is that what makes the faith meaningful in our lives. This connection can be incredibly powerful and life-affirming in times of stress. Finally, faith provides a sense of perspective, allowing us to see our distress in the context of a larger narrative or plan. Prayer and meditation establish connection with Jesus. Thank you.
Thank you very much, Dr. Daniel. You have definitely shared with us very simple and practical points that we all could use in our everyday lives, particularly and most impressively. You've advised us to have positive thoughts that lead to positive outcomes and think about changing the course, developing plans, practicing relaxation, exercising, praying, and practicing mindfulness. I may have left some other few details, but I think I've covered most of it. So, and for you, the audience, I know some of you may have had cases where we've encountered people with suicidal ideation, but it is indeed a problem. I have run into youth and children I've worked with who have had suicidal ideations. And we do know of some of our community members who have taken their own lives. So this is a topic that needs attention. So without further ado, let me introduce our next speaker, who is Dr.Binu Chacko. He's a board-certified psychiatrist who sees adults and adolescents and children. He practices in Jericho, New York. After completing his general psychiatry residency training as a chief resident at JHMC, Queens, New York, he completed his child and adolescent psychiatry fellowship training as chief fellow at the New York Medical College Westchester Medical Center in Valhalla, New York. He has 15 plus years of clinical experience in treating adults, adolescents, children with mental illness, and dual diagnosis patients, inpatient and in outpatient settings. He also treats clients with alcohol and opioid dependency. He's an associate professor of psychiatry in Hofstra School of Medicine. I'd also like to add a personal note that his family and my family, we are family friends. We go back to Tiruchirappalli in Tamil Nadu, and our paths, our lives crossed during our childhood. So without further ado, Dr. Binu Chacko.
Thank you for those kind words and the introduction. So So I have labeled my topic mental hygiene. Thank you. So it's nice to see everyone here, and I was kind of wondering if we would have children here as well, but it's good to kind of hear it for ourselves so we can be prepared to kind of address the children separately. And this is a critical topic to kind of address it with kids as well, starting at a young age, and our school systems are starting to do that. And now I also work in the school systems, and we are able to kind of intervene. Why I went into psychiatry and also why child psychiatry is basically related to how early can we get hold of the problem. The earliest stages we can help the patient or the child, then you can expect a better outcome in their life. Sometimes it's very hard to change the parents and the older people. So sometimes I'm definitely, not sometimes, always I'm seeing a problem, when a child is brought to me, the problem is also with the parents and how they have kind of parented or different things in life. So without further ado, we can kind of take a look at the next slide, and this will kind of explain why, right? In this first slide that you see, this is, Abraham Maslow's pyramid that most people may be familiar with. If teenagers and college students were here, they would recognize this, or some of you may have had this in your earlier educational years. So as you can see, the pyramid, right? The base of the pyramid is the physiological needs that everyone has, right? We know that kids have those particular needs. What are they? Nutrition, water, air, sleep, shelter, clothing, right? Very basic stuff. We all still need it, but as a baby, if the child is given all those needs, all those physiological needs are met, they kind of progress safely into the next stage as they continue to develop. So when some of those things are missing, there are studies that we know done through orphanages and things like that, when the child is not receiving enough social contact and different things like that, the child develops differently. So for good brain development, you need various aspects of this pyramid to kind of go smoothly. So the second stage is that safety needs, right? We all still need the safety, but at a young age, the child only knows, safety through their parents. Like if they're close with their parents and, they will protect them. They know that, right? They don't know if a stranger will come and protect them or not. And we also teach them stranger danger or, avoid strangers, things like that. So they also need that security, stability, right? Roof over their head, and also room to grow, to explore while they can make mistakes, right? They're learning to walk and talk, and let them make those mistakes by walking and hitting their head or falling or saying something wrong. They need that safety, and that safety comes from having a nice, strong, parents who can provide that safety net. Now moving on, social needs. As the child is getting older, you can see like all of your, or maybe your grandkids for some of you, but most of the children who grew up here, we kind of have had friendship circles and social expectations, and obviously in India also it kind of, happens the same way. But we all have those neighborhood friends, and also like the inside family, like cousins and such, as like the, who meet our social needs. So we receive and we are able to give affection as well within these friendship circles, and that can develop into having a good identity as well. We won't go into those different stages. So while these stages are happening according to this diagram, there's also other theories of developmental stages according to Erik Erikson and things like that that we have to kind of focus on as well, but we're kind of making it simpler here. But during those early stages, when kids are learning through their mistakes and things like that, if we allow them to make the mistake and grow, they grow healthy. But if we are, as parents, like very strict and if they fall and we hit them for falling, or doing like running fast and like scraping their knee. If we decide to hit them, it's one form of discipline in India that I have certainly been exposed to, right? So those kind of things can actually instill fear in the child. We don't understand that at that stage. You understand? So it all depends on how we are raising them from a very young age, and how we ourselves, when we talk to our kids, even now, even as they're teenagers or as they're getting older, it's like, oh, don't do that, this could go wrong, or I don't want you to, are you doing this right? And you create all these doubts in their mind, and they just want to do something and explore and figure it out for themselves. But if we put, our anxiety into their minds, they can also kind of grow up to kind of have some anxieties growing up, and they may not try everything that they could try or feel free to try, So the freedom needs to develop, and that means, we have to kind of grow them in a healthy way where there's less anxiety in their younger years. So, that's part of those safety needs and, social needs as well. And obviously the social needs are easily met. Let's say in a country like India, we're all Indians, so we feel comfortable. But kids growing up here have a different dynamic. When they're growing up here, they are seen as brown on the outside and white on the inside. We are called the coconuts, right? So they are not treated like the Americans they are born to be. They may be born here. They may have no accent or anything like that, but when they go into a classroom and they're just one among or five among the majority, they will be treated differently, and that's something we have to understand, and we have to follow up and find out. How was your day today? And those kind of things are very important to kind of make sure that we are teaching our child also openness and communication. Bringing that up because that's also another part and parcel of building them up with proper social strength, social intelligence, and things like that. And also their esteem has to be built up, because sometimes if somebody's teasing them for being brown or having an accent or whatever the case, and if they're kind of made to feel less than who they have the potential to be, they can kind of grow up in that insecurity and feel like, that's not meant for me. Others will, others probably, fit better in that position or doing this, doing that. And our kids have shied away from certain sports or different things because we don't see ourselves as athletic as our counterpart Americans, who are kind of brought up here also, but because we have maybe different physical abilities compared to them, size-wise, or different things like that too. But those kind of things, I'm happy to see it change over the years that I've been here. I've definitely been here many years, over 35, I think. So, I don't look like that photo of back in the day anymore. I'm older, but definitely, experience and working with everyone, has helped me to understand all these principles as well, and myself, right? We look into ourselves and we see all these growths happening, As a psychology major, when I first saw this, it was like, wow, oh yeah, this explains everything. I was like, oh yeah, those needs were met, and that's why I'm healthy in this way or that way. And it was an eye-opening experience. And our goal is to finally self-actualize, right? The top part of the pyramid, self-actualization, to become who we want to become, and what is that, Did we create the right environment in our children to help them become self-actualized, Are they ready to, go into the world and face whatever the problem is? Because I know for certain some of our kids have not, they've kind of grown up in a sheltered house and they haven't been given the freedom, and sometimes they are in doubt, can I become such and such person, and will I succeed if I choose this path versus that path? A lot of our kids just go into engineering, medicine, or different things like that. We have started to slowly break that mold over the years, but, it's no longer just those kind of fields or nursing and things like that. And we have to encourage the, kids to go into these different fields because they can be successful at many things. It's just that we're not exposing them, or they haven't been given the freedom, to kind of choose the path. So I hope everybody kind of understands this. So we'll kind of go on to the next slide. My topic for today was supposed to cover, anxiety disorders and also depression. So we'll kind of cover those topics as well. So we've all kind of felt anxious at times, we can call it fear. Sometimes when small things are, causing us some fear, like let's say a spider or seeing blood or, being afraid of a car accident, things like that. That's a fear that everybody can have. But anxiety is something a little bit more prolonged, It's like a constant feeling when there is no particular threat right nearby. Fear is an emotional, physical, and behavioral response to an immediate, recognizable external threat. But anxiety is a distress that you kind of constantly feel, an unpleasant emotional state of nervousness and uneasiness. And this develops for various reasons, and we'll kind of take a look at that. So anxiety disorders are more common than any other class of psychiatric disorder. Is there anybody who will say that they haven't felt fear here? Right? Everybody has felt fear, right? If I ask you to raise your hand. Now, can you kind of look into your past and kind of tell me, have you ever faced anxiety, an unpleasant feeling for days or hours, more than just fear, right? I see some heads nodding and all that. And if we actually look, it could be just the exam, right? Let's say, we have anxiety about exams sometimes, and then getting the results and waiting for the results, right? And that itself, that's also anxiety. It's brief, but it's not a disorder per se when it's limited in that time. But if it's prolonged and happens for days, and it's also starting to cause problems in your functioning, like with anxiety, you will lose focus and not be able to concentrate and perform well in various things. And it can even become debilitating where you don't want to leave the house sometimes. We call that agoraphobia, right? So when symptoms are worsening, people can trap themselves, Anxiety can become the ball and chain and make you a prisoner to that. And we'll kind of dissect that a little bit more. If we can go into the next slide. We all have worries in our life, and as we kind of look into, various things that worry us, some of us here have kids that they worry about. I'm sure most of your kids are, excellent and in good position. Obviously, we are of that community that's the most successful community in America, right? We are in the Asian community that, we have to be proud of that. That's true. But still, in our community, I know, right, for sure, we have other problems as well. Like Dr. Daniel said, and others have mentioned, we've all seen kids who have, anxiety, depression, who have committed suicide. It happens in our community, and we have to accept it, and we have to know that our community is just like any other community that has come before us here. And as we absorb the culture around us, right, it becomes more and more, molded to that culture, right? Like some of the statistics that we have, it may not be accurate to our community right now, but as time goes, as generations of kids grow up here, they are going to have very similar statistics, even though I think it's already very close, Schizophrenia, 1% that Dr. Daniel mentioned. We have schizophrenic patients within our community, we have bipolar disorder, we have substance abuse, right? All these things, why? Sometimes people get into substance abuse and other things because of anxiety type situations, right? They think, oh, let me drink a little bit of alcohol, that'll help my problem and numb it, right? And they try to resort to different things. But these are just like certain categories listed here, right? Problems or our worries can be related to family issues. There are people who have arguments and fights within the family, right? Married life. And that's one thing we have to kind of accept and know and also seek help for, you know? How many of us will go to a marriage counselor, you know? Are we open enough for that? You know, hopefully we can have an open discussion about those kind of things, like if we are actually ready to get help, okay? Because that's one thing. Definitely a lot of Malayali people come and see me, but that's not enough. You know, there are so many people, even educated young people, who I think should have no problem coming to see me because they understand the illness well and all that. They have come to me for one session and then shied away, and, you know, because of the stigma of like having to take medications, or when they hear the reality of the diagnosis that they, you know, are diagnosed with, they no longer want to continue, you know? And in America, I can't force them, right? A lot of times, like, their parents have suffered for many years, and the parents will ask me, can I just take him to India forcefully and medicate him over there and bring him back? It's like, it's up to you. You know, that may help, you know? And I've helped some people to kind of, you know, proceed along in that path of their choice. But, you know, there are various things like that. So it could be family-related issues, school-related issues, you know, failures, things like that, you know, friendship-related issues in their particular, you know, adolescent age, or other things that can cause us worries. Moving to the next slide. So to kind of understand anxiety better, the symptoms of anxiety is kind of highlighted there, right? Uncontrolled worry, excessive nervousness, sleep problems, muscle tension, poor concentration, increased heart rate, upset stomach, avoidance of fear. So avoiding to go out and staying indoors, those kind of things like I mentioned. And there are different types. Generalized anxiety is one where the anxiety is more prominent and every day in various type of, you know, categories you have anxiety. Then there's phobias and panic attacks as well. Panic attacks can be also very scary. Some people will feel like they're dying, you know, they can't catch their breath. And sometimes it can even get worse, and people can start thinking paranoid things when they are, you know, anxious. And even panic attack, you know, leads to some of that. And that's like Dr. Daniel was saying, some people, when they're under those kind of stressful things, you know, if they're a little bit impulsive, or if they feel like, you know, they cannot handle this, what do? Sometimes they think for the easiest way out, and they do an impulsive thing to, you know, try to end their life. And that's why it is serious. Sometimes there's help for it. You know, we know there are medications for it. There's therapy, all these other things that we can do or start doing at an earlier time, right? Sometimes people are coming to us at a very late stage to see a doctor, but, you know, we have to be educated as a community and be open to kind of reduce the stigma. And we'll kind of maybe talk about it during the later part when we discuss questions, you know, from the audience and such. Moving on to the next slide, to kind of give you a bigger picture of that anxiety that we were talking about. It just kind of, you know, starts out as anxiety, and then some avoidance behaviors, and then as the diagram goes, you know, there's, when you avoid certain things, you find some short-term relief, and you think like, you know, you're handling the problem. So avoidance can be, you know, like for a student skipping class if they're anxious about, you know, having to do a presentation, or the teacher calling on them, right? Versus using drugs and different things like that. And anyway, it may provide some short-term relief. A lot of our students in our community, you know, are starting to use substances for these reasons, believe it or not. You know, those are things we have to accept, that this problem is here, you know. They may not be here, as I say, literally, but it's within our community. And then the long-term anxiety is also something that we worry about, right? Where they are having this diagnosis of generalized anxiety and such. Moving on to the next slide, like I said, there are some exclusions also for, you know, actually diagnosing anxiety, medical reasons, you know, things like that. So obviously, always go to a doctor and start with your primary doctor to discuss the symptoms. You don't have to feel, you know, that anxiety has to be treated by a psychiatrist. Sometimes it's very easy for primary care physicians to treat it as well. So always seek that medical attention first. And, your treatment is private in the US, right? You can keep it even private from your spouse in this country, but obviously you want the larger number of supports, right? The more the supportive system that you have, like if your wife knows or your parents know or your brothers, sisters know, and they like to help you out, it'll be better for people to kind of recover from various type of stressors like these. So moving on to also, other treatments, we can kind of skip to the next slide and the next one. So there are obviously therapy and, medications like we mentioned before. So with anxiety, lingering in your system, what can happen? One of the things that we see is anxiety sometimes leads into depression, right? So there's a problem, whatever the problem is, right? If it's family or other things, whatever, those kind of problems can kind of become bigger, and it can also bring your mood down. Basically, we call it sometimes not anxiety, we just call it stress. It's been too much stress because it's not anxiety symptoms per se, but it's like, having difficulty at work, and then you're not progressing in the work environment, you're not finding happiness there, and things like that. And then, these are the symptoms obviously in depression, right? The mood is down, so depressed mood, you start to lose interest in the regular things that you find pleasure in, things that were enjoyable as hobbies or other things. And then sometimes as it gets worse, you may have sleep difficulty and significant weight change, feeling fatigued, tired. And then some people get worse and worse, and they can get feelings of worthlessness and even suicidal ideations or thoughts of dying or wanting to die. And that's when we worry about them more. Again, like Dr. Daniel had mentioned, he sees the more acute people, right, like in prisons and such, who definitely have a lot that they've lost in their life. They're not going out and, having any support system with their family and things like that. Just like that, our own community, if we promote this through stigma or not sharing or talking with your own parents or siblings or, people who are friends, it becomes very hard. And they kind of suffer alone, that's also a loneliness that they kind of bring on. You can have all the family around you, but if you are depressed, and you don't want to share, you kind of drive yourself into loneliness. And this is something we're seeing, right? And then sometimes if depression is not treated for a very long time, the person can even produce these psychotic symptoms in their mind, they can get paranoid about things, and without also because of lack of sleep, those kind of symptoms can develop. And we have had, diagnoses like major depressive disorder with psychotic features that we have to treat in the hospital right away, admit them and things like that. Because when they're psychotic, they're not in touch with reality. That's another time they can kind of harm themselves, So their only way out is, the shortcut, right? So, when we see all these patients, we definitely, feel for them, for their difficulties that they face, and, how can we help them? That's something that we also need to kind of face as a community. So, as we kind of progress to the next slide to kind of wrap up about depression, similar to anxiety, the stressors are there, right? Whatever the stress may be, job, family, whatever the case. And just like Dr. Daniel was saying, it leads to thoughts, those negative thoughts. Sometimes, feelings and negative, some physical symptoms will show up as well. And these things will, bring your body into a, uneasy place. You're not gonna feel healthy, when you don't get enough sleep, all these different things. You can get easily sick, your immune system is gonna go down. And various things come up, and then behavioral responses also start showing up, right? Now you get angry with people too quickly, or you don't, interact with people. Maybe you start doing something negative. Maybe you start covering up your problems by lying and doing other things. And these type of illnesses can be can give birth to sin in one sense, right? because we're all trying to, be the proper people, in front of everybody else. If we don't honestly try to see who we are, and if we are not able to share who we are with our own community, we can go into hiding within this larger group. How many of you are able to, speak to everybody in your own church? Nowadays, our churches are so big, right? 220 members and such. We barely get to speak to like 3-4 people, or 3-4 families, right? And then, it's time to go because there's next program, and we have to go home and eat lunch, etc. But sometimes that type of socialization itself is not enough, right? That's why we have prayer meetings, right? Which is good. We get to see a smaller group, right? Here we can interact, or we can interact better in that Sevya Sangam group, or Yellow Mission, right? Youth Fellowship. All these groups are there, right? Within church, This is the community that can actually serve to protect certain problems from getting worse, and probably prevented some problems already that we don't measure, right? We're not doing statistics on those things. How many people have benefited from young, youth fellowship or other types of organization? I'll raise my hand, right? So just like that, I know many of you have experienced some kind of benefit from being part of a group, right? So moving on to the next slide. Sometimes, depression is seen as a weakness, which is a problem, okay? Sometimes depression is seen as a weakness, and some people say, why don't you just get up and do it? It's like, come on, you just gotta do it and everything will be fine. But it's not that easy. You don't just get up and start doing something, and make it go away. It's because of all that stress, a lot of things have changed in your physical body, The body chemistry has changed. Sometimes the serotonin level is different in your body. The serotonin receptors are not the same as what it used to be when you're having fun, or having a happy life. So there are various things, and to kind of keep it all in balance, you got to practice various things to protect yourself. Then there's the psychology of strength and weakness, right? That if you ever get to read William Glasner's book on positive addictions, it's basically about good habits, right? Dr. Daniel had mentioned about deep breathing and mindfulness and different things that we can practice, exercise, right? Even there are other doctors who have done research and told us about how phytohormones, basically the smell from the trees, right? When you go walking in the park, if you can smell nature, even those, phytohormones that you can smell does benefit to release endorphins and other chemicals in the brain that help you feel good. Exercise, obviously, right? Everybody knows that. What's the minimum number of steps we need? We all have iWatches, but what's the minimum number of steps we need to prevent depression from setting in? 10,000? Yeah, right? So we know that. How many of you are walking 10,000 steps, right? In our community, do we take exercise seriously? Sometimes those things are very important, and it's very hard, but that's a small, easy fix, right? Back in India, maybe we walked enough hills and valleys and all that, and it probably definitely got it, right? Got that many steps, but we're not doing that now. We have the cars, and everything can be let's find the closest parking to, let's order in and things like that, right? But that's not going to help. Yeah. So last but not least, I'm going to wrap up with this last slide. Next slide. Yeah. So this is the slide that you want to take away from here. Physical, mental, and spiritual health characteristics, right? So when we have to build ourselves up, we have to look at our physical fitness, right? Strength, flexibility, endurance, focus, coordination, resilience, and teamwork, right? That's what will help us to be a good team in whatever sport you want to play. When it comes to mental health, same words. Look at the similarity, okay? Strength is equal to confidence and courage. And in your spiritual health, it's faith. Okay, do you see the connection? That confidence, that courage, where do you get it from? You know, we as a community, we're strong. Why? Because we are a faith community. We're practicing it, right? And this is why, you know, that our kids need to know, like, these are the basic ingredients to stay healthy, right? Faith is like one of those basic needs that we have to kind of cultivate, just like, you know, we have to do physical activity to, you know, maintain good strength. Flexibility is adaptability. You know, when it comes to whatever this difficult situation, are you adapting to that situation? You know, same thing, when you're in a spiritual sense, are you forgiving? Are you forgiving yourself is one of the questions you should ask also. You may be okay to forgive somebody else, but you may be tough on yourself and not forgive. And that itself is a doom. You know, be ready to forgive yourself if there's something that you need to forgive. And then endurance is cheerfulness and hope. Focus is basically, you know, your focus is going to be in spiritual sense, love, right? Love everybody. Coordination is, you know, when you are building coordination through practice and things like that. Obviously in mental health, you know, more and more interactions you have within the community, you know, that also is helpful to build harmony, right? And that's done through kindness. And our resilience is built up as we, you know, grow into these things. And that's the strength in mental hardiness, or charity and generosity comes through that when we feel comfortable enough to give, not just receive, right? Are we all there yet? Are we all able to give freely, right? Without anything coming back. So, and then last but not least, teamwork, right? It's a very important point, and it's one of those things in mental health. We want to have social networks and community, you know, and that is provided through church and various organizations. We have to keep encouraging that. And then that helps us to stay spiritually connected with God. Hope that helps everybody understand the different, you know, things that we all need to build up, right? So for the remaining time, we can definitely answer some questions and build on some of these things we taught. Thank you.
Thank you so much, Dr.Binu Chacko. Unfortunately, I think we are out of time for questions, but there is